Hi, my name is Brianna, and during your 2-year program, you'll either be in health technology or SPN, any of these programs. So, in health tech, that's what I'm in. You'll have a 2-year program. You can have STNA, you work with elderly people, so probably like a nursing home. You can go around, position them, feed them, do basic stuff. And then your next year you'll have your PCA, which is patient care assistant. There, you can walk around at a hospital, help people in that setting. And then you can also have your CMA or phlebotomy during your second year as well. CMA is Certified Medical Assistant. Basically, you're the one who comes into the office, greets the patient, and asks them what their symptoms are, and then says the doctor will be in soon. That's the gist. And then phlebotomy, be drawing blood all day, and we have demos for that.
Hi, I'm Maya. I'm a senior in phlebotomy. Phlebotomy is the practice of drawing blood. You learn the different places where you draw blood, the different tests. You use blood to find different diseases or illnesses. Yeah, so I'm going to show you that.
She's going to show you a quick demonstration here. And you can see on myself and on Nurse J over there, they're actually going to demo drawing blood on an actual person, while Maya over here demonstrates on a fake arm.
So when your patient first comes in, you always want to identify two types of identification. You want them to state their name and date of birth. This is a mannequin though, so they're not going to do that. And your next step would be to ask if they are on any blood thinners. Patients who are on blood thinners are going to bleed longer and more than a patient that is not on blood thinners. And knowing that information will help you prepare for when your gauze part comes, because you'll want more gauze than for a patient who is not on blood thinners. So after you get all that information, you're going to palpate the arm, which is feel around for a vein. Veins do not have pulses, so if you feel a pulse, it's an artery. You don't want to stick an artery. Some patients you can feel veins without a tourniquet, which is this band here. But if you can't feel the vein without it, you put your tourniquet on. Tourniquets can only be left on for about a minute. You do a slip knot, you go under, and you leave a loop at the end. And you feel around again, and a vein should pop out. Once that happens, take your tourniquet off. You're going to get your alcohol. Oh, sorry, put on gloves for a second. And get your alcohol pad, and you're going to clean in concentric circles. Did I say that right? Okay. Concentric circles, starting from the inside, work your way out, pushing all the dirt on the out away from where you're going to be sticking your needle. You let it air dry, don't blow dry or fan dry, because you'll wave bacteria or germs or blow bacteria or germs onto where you're sticking at. While it's drying, you gather all your supplies. You'll need a straight needle, evacuated tubes, gauze. So once it air dries, you reapply your tourniquet. Your tourniquet should be 3 to 4 inches above where you're sticking. Get your needle. You place your tube inside of the tube holder, but you don't puncture it yet, because each tube has a vacuum. If you puncture it before the needle is in the arm, you'll break the seal for the vacuum and it won't be any good. So you pull back your safety cap, you take off the needle cover, and you're going to go in at a 15 to 30 degree angle until you feel a pop. Once that happens, you push your tube in and blood comes out. Once you get blood draw, you release your tourniquet. So then once you collect all the blood that you need, you take your tube out. Always take the tube out first. You need to make sure that you always take the tourniquet off before you take the needle out, because if you don't, you'll give the patient a hematoma, which is bleeding outside of the vein but underneath the skin. You take your tourniquet, You take your gauze, you cover the needle, and you pull out the needle, apply the safety cap, put it in your sharps bin, and you apply pressure until the arm stops bleeding.
Hi, my name's Abby.
My name is Casey.
And this is our mannequin that we can practice different things on.
So here you have a blood pressure cuff. This measures the patient's blood pressure, and here you can feel the patient's pulse. This mannequin also has heart and lung sounds, so we practice hearing the patient's heart, hearing the patient's lungs anterior and posteriorly. Right here, the patient is receiving oxygen, so we practice with that, and this is where you will insert the oxygen, and it'll tell you how many liters over there. This right here is called an sensitive spirometer. Usually patients who are receiving oxygen usually take therapy for this. The patient will insert this end in its mouth, and right here, this thing will move, and it encourages deep breathing for the patient.
This mannequin also has a tube where we can practice giving medications parenterally, which means inside the body, so it bypasses the stomach. It also has a stoma, which would be if it had a colostomy or an ileostomy. You can also use fake syringes to practice putting medication and feeding through the tube.
So we are in the lab called Secondary Practical Nursing. To get into this program, you have to have certain requirements. You'd have at least a C in biology, 95% attendance, and a 3.0 GPA or higher.
You have to pass the ACT work keys, which is a combination of reading, math, and interpreting, like graphs, and knowing that you know how to understand what you're reading.
Hello, my name is Lauren, and this is Margarita, and right now I'm standing next to a med cart, and we use this in order to, this is used at hospitals and healthcare facilities in order to pass our patients their medications. And you see it's organized by their room number, and if you open a drawer, it will have their meds in it that you need to administer. It'll also have things like liquids and narcotics that are locked up to make sure that it's safe usage. And then here we have Margarita that is going to show you how we inject patients at clinicals. And we also go to clinicals, and we use this at clinicals, and clinicals is basically when we go to a retirement home or a healthcare facility and we practice the skills that we're learning. So we'll use a med cart like this and pass our patients the medications, and if they need insulin or a shot, then we'll give that. So we're practicing while we learn. And while she's doing this, when we get out of our program, I'm an SPN also, like Casey over there. When we get out of our program, we are a licensed practical nurse. We become an STNA, a state tested nurse's aide, our junior year, and then our senior year, we test to be an LPN. And you see her cleaning the site with alcohol, and she's going to inject it at a 90-degree angle with 1.5. And then she's hitting it to get all the bubbles out. And this is just the type of things we do at clinicals on actual real people to make sure that we can do this when we become LPNs after we graduate.
Ask about the pay range. The LPNs people get between $20 and $22 an hour. The STNA get between $12 and $14 an hour, and the PCAs get between $14 and $16 an hour. So it kind of depends on where you're working, but that's the average of what they would get. I mean, right out of high school with those certifications.
I'm Kaylee from Harrison. I'm going to do a disc closing on her teeth, which is a red dye that shows the plaque on her teeth, which is like bacterial sticky film that covers your teeth when you don't brush properly. So that is what I'm gonna floss her teeth.
Oh, my name's Madison, and I'm just assisting her.
I'm Hannah. So I'm going to put this cotton swab inside of the dye. And it's going to look like a purplish red. And I'm going to put it on her teeth. You want to make sure you don't get it on her lip because it will stain. Alright, now I'm going to have her rinse. And then you'll be able to see where she doesn't brush her teeth properly. And usually it's along the gum line or in between teeth. Because that's where people miss the most while brushing. Now, if you would smile. This is where she does not brush. I don't know if you guys can see that or not. Yeah, that's where she does not brush. So now we are going to brush it off. This is a pre-pasted toothpaste or toothbrush. So now it's pre-pasted. It has like toothpaste on it already.
Cool, I didn't know they did that.
Yeah, it's pretty cool. So what we're gonna do is we're gonna brush at a 45-degree angle and in circles. So you will see it will come off. Okay, starting out is $12 to $14 right out of high school. But if you go on to be like, go to hygienist gets what, 23-ish?
I think it's 22.
Yeah, and then an EFTA is like 18 or something.
Yeah. And EFTA is an expanded function dental assistant,
So
so
the more education you get, the higher the pay.
You have to be a dental assistant for 2 years to apply to be an EFTA. I think it's like 16 months more of school.
you're gonna go in and you're gonna seesaw it, and you're gonna use your pointing finger and your thumb to guide it. You're gonna go in, and you don't want to touch the middle of the gum because it will start bleeding, and it'll hurt. So you're gonna go like this, and out between every tooth, and you want to make sure you get both sides of it, and then that will get rid of all the plaque in between your teeth.
Hi, I'm Kiesa. I'm Raven.
I'm Mallory.
And we're going to be doing alginate impressions. So we take alginate impressions to make bleaching appliances, retainers, mouth guards, and things such as that. So we're going to take 2 cups of cold water. She already put that inside of the bowl. And now she's going to take 2 cups of alginate. And she's going to mix it really fast because it sets up really quick. So she's going to just mix that together. And once it's all mixed together, she's going to take this tray, mouth tray, that fits your patient. She's going to put it inside of there, and then we're going to put it inside Mallory's mouth.
We do internships. So your senior year, you can go morning and take your 4 academics classes, and then leave at lunch and go to work at a real dental office and get paid for it. So that's pretty cool, I think.
So as you can see, Kiesa has the tray full of alginate. She's going to relax Mallory's cheek, do side to side. She's going to pull her bottom lip out, and then she's going to place it into Mallory's mandibular arch. And she's going to press down on it so we can get the teeth inside the impression. And she's going to let it sit 2 to 4 minutes. And Kiesa pulled her head forward because most people have a gag reflex, which they might end up throwing up wads in their mouth. That's going to sit 2 to 4 minutes, and then this will what the final impression look like. You're going to get all the anatomical detail, the frontums, and everything.
Hey, look at that.
Actually, the question is there a lot of jobs available in the workforce for this program? Yes, there actually is. I get the question a lot, why would you want to work in somebody's mouth? And that's what a lot of people say. So not a lot of people go into dental as they do nursing, because nursing is a more common job than dental. So there is actually
Hi, my name is Rachel Harvey, and I'm the junior in the dental assisting program. And after they go ahead and make the appliance, then we come over here to the lab to pour up using the a plast, like it's a, where's this stuff right here? It's a plaster or gypsum, which is another word, fancy word for a plaster. And we take this over, we take about 2 scoops for a bottom impression and about 3 for the top. And then we add just a little bit of water, which Kaylee's doing right now. And when they mix it up, we make it to about the consistency of like peanut butter. So as you can see, she's mixing it up. So then after we have mixed the water in with our stone, then we come over here to this thing right here, which is called a vibrator. And we're going to vibrate all the bubbles out of our plaster so that when we pour it up into our impression, there's no bubbles, because when you take it out of the impression, if you have bubbles in there, you won't have your full impression of your teeth that you've taken. So she's going to go ahead and turn that on. I don't know how much you guys can see, but we vibrate it for about, just enough to get the bubbles out, which is about a minute, but we might not do that full thing here. I don't know. Do you want to... I'll just take it off and just cut it away. So then after we vibrated it, we put it into the impression here by adding it on the corner, and we let it flow into the impression to the other side while it's on the vibrator. So then after this is filled up and we have the stone into the impression, then this takes about 20 minutes to set up, and while it's setting up, it's usually kind of hot while that's being, if you feel it, and then once it's done, we break it out, and any excess material that you have on the outside of the impression will be on the outside of this, but we take it over to this grinder, and we turn this on. It has water in it, goes through, and we grind off the excess stone, and so that this is like what it would look like afterwards. And then we make our bleaching appliances, or another thing you could make would be like a mouth guard. This is what it looks like after you've put it in the impression. And this is after we've ground down. This here is thermoplastic, and this is what we use to make the plastic appliance. So this here is a suck down appliance which will be used to melt the plastic. And we'll set our model underneath. And this here, this plastic, gets really hot, and the plastic will like dip down on there, which we'll see in a second. But this lab is really cool, guys. So if you are thinking of this, I would say that I absolutely love this lab, and it's really neat, the different things that you get to do, and it's a great opportunity. So I would definitely say, if you're thinking of coming to Scarlet, that the dental assisting program is a pretty awesome lab to be in.
I'm Mrs. Tucker, and I'm the instructor for the Surge Tech program here at Scarlet Oaks, and then these are my students in the background, and I'm going to quickly go through the different stations to let you know what we will be doing here if you decide to come to Scarlet for the Surge Tech program. This in this first station, you're going to see a surgical team that is actually going through different motions of what a surgery would be. We'd set up 2 different surgeries, and there's a surgery in OR1, OR2. You would get a schedule just like you would in the operating room. You would come in the day, your initials will be by a room, and you would go and do whatever surgeries would be scheduled in there. In the first one, we're going to be simulating a hernia surgery. And then in the second one, we are doing a TNA. Now, in the operating room, it's very important that you do your surgical counts. So they learn how to count the sponges and the instruments. There's going to be there's at least 3 different types of counts done. It's an opening count, an intraoperative count, and a closing count. So it's very important that those are done. The Surge Tech program, you would be getting a 12 points towards your surgical tech career if you decide to go to Surge Tech school, but you would also, at the completion of it, be taking the national boards for central sterile processing. Okay, TNA is tonsils and adenoids. I know probably many of you all had your tonsils and adenoids taken out, and we use acronyms a lot in surgery, and I apologize for not explaining that, okay? And also, hernias could be different kinds. It could be a umbilical one, so an umbilical hernia, or you can have an inguinal hernia or a ventral hernia. They all describe the location of where the bulge is, and so that's how they are listed on the board, and so we know as to what part to work on. And so there's different instruments for those procedures, and so you have to know all the different instruments for the different parts of the body that it goes on, so that you would know. So you would learn in the program about 300 instruments by the completion, and that's really just a little bit of instruments that you would have to know to be a surge tech. And then as we go on through here, what you would do is you would set your case up, do your procedure. Then when you get finished, you would do your final count. You would undrape the patient, put all your instruments into a basin, and then you would take it to an area called decontamination. And if you look over here in this area, this is decontam. And these girls, could you turn around, girls? Okay. These girls are washing the instruments. And so when you get the instruments decontaminated, taking all the bioburdens off, and then that's completely done there, then it would go through a washer sterilizer and come out on the other side of the room, or in a really different room, which is simulated over here, where they would wrap it, package it, and start processing, getting it ready to go back on into distribution. Here would be the wrapping and labeling. Everything is going to be labeled and then put back on the shelf. And then when the surgery is asked to come down and do another surgery, they'll know what to pull off the shelf in order to send it to the OR to start that whole process all over again. To learn all the stations, you're going to have to learn the pre-op with the vitals, take your patient to surgery, perform the surgery, take your instruments to decontam, come through sterile processing, and back out to distribution. And you would also have to know all the data and records that's required by all the national boards that for sterile processing. You can go in many different avenues. Even after Surg Tech, you would go in the first assisting and central sterile. You can also go into different specialty areas and not just one area there. So need a 3.0, okay? And you would usually you're going to get and you'll do an ACT and all those as you get out. Most of the colleges will run a 3.0. For your national boards, you have to have a 70 or above. You would take a pre-certification exam with me. You'll get 3 chances to do that, and you must have an 80% or better in order to sit before the boards and pass those boards.
Exercise science. And here we have the splint board. You can do this on land and on water. The person at the head is in charge. Right now they're sliding him onto the spine board. As you see, the person at the head is holding his head steady. They put 2 foams beside his head to keep his head steady. Over here we have the bench press. There are 5 points of contact. Make sure there's always a spotter, and the person lets them know how many sets and reps. And when bench pressing, make sure you always have collars on the weights. There are 2 orange dots on the side of the treadmill. He stands on those until the treadmill has started, and he will step on once he is ready. He can up the speed or the incline of the treadmill. And the treadmill calculates how many calories you burn, the time, the distance, and heart rate. Taping Wayne Andrews' wrist as she puts pre-wrap. Pre-wrap is important because you never know when a patient is allergic to the tape. So make sure you always put pre-wrap on first. She's going to do an anchor, which always keeps the wrist intact. Anatomy, we learn the muscles and bones of the body. There are 206 bones and 600 muscles in the body.
Okay.
She does another anchor at the top.
And what kind of career fields can you go into from here?
You can go through athletic training, personal training, physical therapy. There's a massage therapy. There's a bunch of opportunities you can get. See, this is the blood pressure. He slides the thing onto the patient's arm.
Question says, what jobs can you obtain out of high school? We can earn a certified personal fitness instruction. That's anywhere from $8 to $45 an hour. Or you can earn the AMCA physical therapy aid. That's a $31,000 job right out of high school.
And his blood pressure is 94/62. Normal blood pressure is 120/80. Hypertension, which is high blood pressure, is 140/90. And low blood pressure is 110/70. The muscles in the body. The longest muscle in the body is the sartorius. and the muscles on this body are labeled as she's putting the muscles towards the body in the correct spots as they should be.